Did you know that half of heart attacks, their first sign is sudden death? These people don't get a second chance. That's 50%, 5 out of 10, half of them. And the worst part is the test that most doctors use, the stress test, that cannot predict heart attacks. So about 10 years ago, I found I had arterial plaque. The first thing that crossed my mind was I could have a heart attack anywhere, anytime. I lived in the bluegrass area of Kentucky, near Lexington at that point in time. I used to run in beautiful horse country, some of the most beautiful horse country in the world. And I thought, if I have a heart attack here, the week that I discovered my plaque, I went out for my weekend long run. It was a couple hours. And if I have a heart attack here, it'll be hours or maybe even days before they find my cold, stiff body in a ditch next to a beautiful horse farm. Now, I know that sounds dramatic, and I got over that. And I said, look, I do this for a living. That's not a problem. I need to head on out. And I did, and I was fine. Now, here's the question. If there's a storm that precedes these heart attacks, why don't people recognize that storm? Could we recognize it? And if we could we actually even intervene and prevent that heart attack? That would have a lot of promise. And let me tell you, we can. In this video, I'll show you how to recognize the storm, why stress tests don't predict heart attacks, and let me give you an example. This is a typical story. The setting is Washington, D.C. The date was April 29, 2008. The office of Dr. Michael Newman. It's in that Tony district there of Georgetown. He was like the doctor or the internist to a lot of D.C. stars. It's a familiar patient story. 58 years old, non-smoker. Family history was not that remarkable. His waist size has grown to over 40 inches. He had high blood pressure. It had been controlled on an ACE inhibitor, but he was having more trouble with it. Total cholesterol, LDL cholesterol, these were not remarkable. C-reactive protein, his doctor even had checked that. It wasn't a big deal. Cardiovascular risk estimate, less than 10% over the next 10 years. So relatively low risk. But he said, hey, doc, I'm worried. Could we just do a stress test? Because he'd been gaining weight. He had to eat out a lot as part of his job. He was a runner, a jogger, but didn't do a whole lot of high-intensity interval work or resistance work. They did the stress test, and it was normal. They changed his meds from an ACE inhibitor to an ARB, and again, you don't have to remember any of these technical terms. The patient went back to work. 6 weeks later, on Friday, June the 13th, 2008, he collapsed suddenly at work at 1:30. A CPR was performed within minutes. EMS arrived at 1:40, and he arrived at the hospital at 1:44. 3 shocks were administered en route to the hospital. He arrived at Sibley Memorial Hospital and was pronounced dead at 2:23 p.m. The autopsy showed soft plaque, a clot in the LAD. You've heard of it, the widowmaker. That's the place where if you're going to get plaque in the arteries of the heart, it's the most likely place. Now, look at what Dr. Newman said on this video. This is the sad story of Tim Russert.
This morning, as most mornings, he got on his treadmill and was always excited about how he pushed himself. These events, these sudden cardiac events, occur without warning. There's no way to anticipate or detect them.
He had just returned from family vacation in Rome. He was celebrating his son's graduation from Boston College and his birthday. His wife and son had remained in Rome while he returned to prep for that Sunday's Meet the Press. He was the longest-running host and the most loved host of Meet the Press, where he would take a Washington, D.C. politician and show videos of 3 years ago and say, well, wait a minute, this is what you said you were going to do. You're not doing anything like that. That's what the public loved Tim Russert for doing. He walked over to the sound room to do some voiceovers. On the way, he greeted the editing supervisor, Candace Harrington, and he said, what's happening? If you weren't around in 2008, that was sort of like what people mean when they say, what's up? Same thing. Those were his last words. He collapsed, and you know the rest of the story. He'd been the host of Meet the Press since 1991. Passion, research, ability to find clips of inconsistencies in his guests' past, again, had endeared him to the country and the whole world. A plaque had ruptured and ended those interviews in his life. Why did this happen? A ruptured plaque ended his life. He'd had a positive calcium score 10 years earlier. It was 210, that was the score, and that was back in 98. Doctors Newman and Brown said the autopsy showed a surprising amount of plaque, and the pathologist said the lining of that artery looked like the face of a teenager with a severe case of acne. There was just a lot of these pockets of inflammation. Carl Levy of the Oxner Review said, you know what? He had to have less than 50% occlusion or blockage because the stress test was totally fine. If we went through that whole interview with Dr. Newman earlier, that's one of the things he said. He said we could have done a stress test the morning he died, it would have been normal. So they knew he had plaque. They knew he had problems. Why didn't they fix it? Well, they couldn't. Well, that was 08. That was 15, 16 years ago, right? So they can fix it now, right? No, we can't. So again, in fact, most people are never going to see it. Just like Michael Newman and Tim Russert's doctor, Tim Russert, did not see this coming. Here's the reality of America. Half of Americans don't know that the number one cause of death is heart disease. Half of heart attacks end up in sudden death. 93% of Americans are metabolically unhealthy. They're not at optimum metabolic health, and therefore they're at risk. There is a better way to predict a heart attack, CIMT. CIMT finds plaque. Arterial plaque is a waxy substance that deposits in the artery. CIMT would pick up all of those pimples that they described in the arteries in the path report when they did the autopsy for Tim Russert. So again, it's a waxy substance. It deposits in the wall of the artery. When it gets inflamed, it can rupture, creating that look of pimples like the face of a teenager with acne. Now, if you go back and look at actually what happens during the heart attack, inflamed plaque can leak back into the flow of blood. If it does, it can cause a clot. It's the clot that causes the heart attack, not the plaque itself. That's when the plaque is inflamed and soft, full of immune cells and immune fluids, and the consistency of mucus or snot. And it's very similar to mucus or snot. It's full of immune cells and liquid. There are three types of plaque: soft, calcified, and mixed. Carotid arteries are the windows into our cardiovascular system. There was a study of over 10,000 people. It was called the Cafe to Cave study. It looked at what they thought were healthy subjects, and they followed them for 10 years. 40% were female, 35 to 65 years old. Carotid and femoral ultrasounds. So they did ultrasounds of the carotid artery right here and the femoral artery. 98.6% of those with plaque suffered a cardiac event within 10 years. So you've heard us in different shows talking about the CIMT saying this picked up 98.6% of heart attacks. And let me tell you, that is a lot better record than stress test. Now, is calcified plaque really more stable? So once you start studying plaque like this, you begin to realize that calcified plaque is very, very different from inflamed plaque. This is from the Honda study. We're going to show you a chart here. It's got a Kaplan-Meier curve on it, basically showing every time each of these lines drops, that's another event. So as you can see, the people that had calcified plaque had a couple of drops in the very beginning and then stabilized. Their plaque was just as stable as basically having no plaque at all. The people, on the other hand, that had uncalcified or soft plaque continued to have events. Now, what are the advantages of CIMT? Well, it's painless, it's non-invasive, there's no radiation, there's no needles, It's inexpensive, no disrobing, you don't have to take your clothes off, and it's safe for all ages. That's why you'll see on nomograms plenty of surveys done on children as little as 5 years old and even younger. There's no prescription needed. Now, it sounds like it's a perfect study. Not really. There's some problems with perspective. If the person that does your CIMT isn't really clear on their standards and how they went in, they can see places that look like a lot more or a lot less plaque than you actually have. So it's very technique driven. The research and the evidence shows some challenges. A lot of the research was done by people who didn't know how to do these. So you ended up with an effect of garbage in, garbage out in terms of the research. The standards have suffered because of that. But here's the biggest issue: access. To get a good one, you can't just go to the local x-ray department or the local hospital. There's only a few places in the country that I've found that get good CIMTs. Now, a couple of them do them in many parts of the country, so people throughout the country can access them. It's just not that easy. A company called Carotid Care has found that 85% of their patients showed plaque and are at risk. So as you see, heart attacks don't just suddenly happen. Heart attacks happen within a storm. Get the right tests, change your lifestyle, and ask the question, why is this so common? And why is it so common that the people that have these problems don't know? You would think that we would all learn the common signs and symptoms of a pending heart attack that's getting ready to happen. We might, if there were any. You will hear people talk about, oh, this is a sign of a pending heart attack, or that's a sign. The bottom line is, if you're waiting for a sign to tell you about heart attack to prevent it, I hope you're feeling lucky, because for most people, there are none. So then I guess you would ask, what are the doctors doing? Doctors are supposed to be helping us stay out of this mess. 3/4 of doctors don't know how to diagnose metabolic dysfunction, metabolic disease. We go into depth in that in a couple of other videos. A1C, it misses more than it catches. Even the ADA has said that. A1C can miss up to 70% of cases. You know, if you ask your doctor how he or she diagnoses diabetes, he or she will usually say A1C. And that's what they think. The vast majority of diabetes cases that have been diagnosed are actually diagnosed with fasting glucose. And it was usually done for a surgery or something else totally unrelated, and surprised both the patient and the doctors. So as you see, 75% of doctors just don't know how to test for diabetes and prediabetes, let alone diagnose it. So how do you diagnose it? Metabolic disease, insulin resistance, prediabetes, diabetes, oral glucose tolerance tests. And even with an oral glucose tolerance test, you do need to get the insulin response. What that turns out into is a Kraft insulin survey. Those of you who have watched a lot of YouTube have heard many of us discuss the Kraft insulin survey. We do that every day with our patients. I mean, we'll have patients coming in. Our recommended cadence for that test is once a year. And we do these all the time. And it's really clear. You'll still miss about 15% of cases if you don't do that insulin response. The bottom line is we see patients coming in all the time that have totally normal fasting glucose, totally normal A1C. And yes, the academicians want to talk about HOMA-IR, totally normal HOMA-IR, but still have diabetes, prediabetes. How is that? Well, again, it's not any one specific time period. It's how our body metabolizes glucose from start to finish. Now let's talk about cardiovascular inflammation. I've mentioned that a couple of times. What is it? You know, most doctors don't even understand cardiovascular inflammation. They understand that inflammation is an immune response. They talk about it. For example, there was a lot of attention paid to it with that lymphocyte storm or that immune cell storm. It's an exaggerated immune response. It can happen with lymphocytes, polymorphs, any of the different types of immune cells. And you don't need to remember any of those clinical names. It's just an exaggerated immune response. That can hurt the blood vessels in the crossfire. See, that immune response is directed towards plaque. Your body does not want to have plaque inside the walls of the vessel. Your body also doesn't want to get the lining burned with high glucose and high insulin. Those things will cause this inflammatory response. And that inflammatory response hurts those blood vessels. Chronic inflammation leads to soft plaque. Soft plaque leads to heart attacks, strokes. It's the number one cause of blindness. Strokes, heart attacks, Alzheimer's, kidney failure, and for the men, even erectile dysfunction. So when you think about it, metabolic disease is the hurricane. It is the major underlying driving force. And cardiovascular inflammation is like one of the many tornadoes. We just had Hurricane Helene come through this part of the country. And yes, it was devastating. The major power came from that hurricane. But there were places where tornadoes just came down and beat up major sections. Again, metabolic disease is like the hurricane. Cardiovascular inflammation is like the tornado. Now, how do you figure that out? How do you know if you have that? Well, here's the thing. Please test. Don't guess. A1C misses 75% of this, and there are better tests. Oral glucose tolerance test with an insulin response, a lipid panel with fractionation, an inflammation panel. So the OGTT, oral glucose tolerance test, has 90% accuracy. It does require drinking 75 grams of glucose, and a lot of people don't like to do that. It requires a couple of finger sticks, too, or blood draws. So 3 or 4, in fact. What you do, you fast for at least 8 hours. Then you get a fasting blood sample, blood glucose, and insulin. You take the 75 grams of glucose. Then you get a 30-minute level, a 1-hour level, and a 2-hour level. There are at-home test options. If at all possible, would like to get an insulin response. Sometimes we see people whose blood sugars are staying fairly within range, but the insulin required is skyrocketing, going way out of the norm. So measuring insulin at the same time as glucose is a very, very helpful thing. Now, you want less than 10% of margin of error to diagnose metabolic disease. You don't want 75% margin for error like you get with the other tests. Lipid panel is a very helpful test. Triglyceride over HDL is one of the key blood indicators of metabolic disease. The lipid panel measures fats and oils and cholesterol inside the bloodstream. There is a major focus on triglycerides and HDL. Elevated triglycerides and low HDL are major risk factors for cardiovascular inflammation and indicators of metabolic disease. We also actually break that down into what we call a lipid fractionation. We look at the actual bell curves for that, quote, HDL, what used to be called the healthy cholesterol, and LDL, what used to be called the bad cholesterol. We measure the particle sizes. We look at problems including loss of HDL large and loss of that large fluffy LDL, which you've heard is healthy. Maybe it is, maybe it isn't, but it's clearly associated. Loss of large fluffy LDL, loss of large HDL are clearly associated with warning signs for metabolic disease. They show that those particles, the proteins, well, I will just mention them quickly, ApoB and even a little bit of ApoA1. Those are those proteins, and you've heard of ApoB. Big increases in that are associated with what we call remnant cholesterol. Remnant cholesterol is a big cholesterol particle. Unlike HDL and LDL, it carries mostly triglyceride. And don't you remember? We said high triglycerides are a major sign of this problem. High triglycerides, high remnant cholesterol. So, why are we taking up protein with remnants? Because they're really big. And why are they really big? Why are they taking up a lot of protein? Because we're unable to burn that triglyceride. Let's go back to the beginning of this video. You remember we said high levels of insulin make it impossible to burn fat. And that's one of the reasons that we get fat. Well, think about it. One of the first places our body stores that triglyceride, that fat that we're not able to burn, is right here in our cholesterol particles, the ones called remnant. And guess what? Your doctor doesn't know that in most cases. So what's happening here is that remnant cholesterol, that ApoB particle, is storing and transporting that excess triglyceride. So are we big ApoB guys? No, we've been using ApoB for over a decade, and we have much better bioindicators than ApoB. But we know a lot of people have been talking about it recently. We just want to help you understand what they're talking about. When they say ApoB is a better test, they mean it's a better test than LDL. It's not a better test than OGTT with insulin response inflammation panel. The best way to find cardiovascular inflammation. So there's several different ways. The first thing that you need to remember is it's not just one test. There are a few people. You may remember we mentioned that back with Michael Newman. He had actually even tested Tim Russert. But the only thing he tested was C-reactive protein. And that's what you'll find with most docs. Very few docs are really testing for any kind of inflammation. Those that do only test for CRP. Here's the problem with that. CRP has a very high rate of false positives. Even just getting a flu shot will cause 2/3 of people to have a false positive C-reactive protein. So we look at a full panel. The first one is microalbumin creatinine ratio. And again, we're going to geek out for just a second. You don't have to remember any of these names, any of the tests. Just be aware of the concept that there's not one good test. You really need to do a few tests to make sure that you know what you're talking about. Microalbumin creatinine ratio. It shows whether or not we're spilling protein. We only spill protein if we've got damage to that lining of our artery wall, that intima. It's a good systemic marker. C-reactive protein, we've already talked about. It's a good marker for inflammation, but there are way too many false positives. Like we talked about with flu shots or even cuts or bruises can cause incorrectly elevated CRP. There are a couple of other markers that we look at too. One is called MPO or myeloperoxidase. Another is called LPPLA2. And we have discussed those in other videos. I'm not going to go deep into that because that gets a little bit geeky. What do you do if you have plaque or metabolic disease? Well, you can start thinking about all these medications and all these supplements and stents. The bottom line is you cannot out-stent, you cannot out-bypass, you cannot out-prescribe, and you can't out-supplement a lifestyle. And among the lifestyle components, diet is the most effective and most important. You need to start with cutting carbs. Over 90% of this problem worldwide is undiagnosed prediabetes. And undiagnosed prediabetes means you cannot metabolize carbs in the healthy way that you could when you were younger. Now, exercise. Body composition is huge. Increasing body fat causes more of this problem. Decreasing muscle mass also causes more of this problem. So in the old days, a few decades ago, my generation, they used to think, well, you just need to go out and jog. Aerobic helps, but you really have to get some resistance training in there and high-intensity interval training. Sleep needs to be healthy. Sleep is going to turn out to be one of the biggest things over the next decade in the research area. It's already starting to show that way. Sleep is critical. Stress, toxins. Now, these are all important things that we need to consider when we're following a healthy life. Unfortunately, the U.S. government is not always that helpful. You look at the food pyramid, what's now called My Plate. I hate to say it, but that's a lie. You know, what they do is they want you to get most of your calories from grain products. So you do need to reduce carbohydrates. You need to include protein and healthy fats. Intermittent fasting is a great way to go. Prolonged fasting. I often get people coming in that have lost 30 pounds. They're motivated and they want to keep going. And they'll say, yep. I'll say, you've already saved your life to a large extent here. What did you do? They'll say, I cut my carbs and I did some intermittent fasting. What else can I do, Doc? One of my next places is prolonged fasting, resistance training, and high-intensity intervals work, and rehit, reduced exertion, high-intensity interval work. You want to include nutrient-dense foods in what you're eating. Nutrients are tools for the body, tools the body needs to perform basic metabolic activities. A good nutrition goes way beyond just carbs and calories. We use a thing called Chronometer app. It's one of those apps that's pretty detailed, and you have to just take a couple of weeks and say, okay, I'm going to spend a little extra time each day entering my information. Once you get better, it becomes easier, and it's incredibly informative. So one of the things that you want to think about, you want metabolically active muscle. And when we talk about resistance training and muscle, men just start thinking about those guns. Think about it. We're talking about your metabolism here. As big as your muscles might be, Arnold Schwarzenegger, bodybuilder, really big upper body, but still his upper body was dwarfed by the muscles in his legs. The muscles in your legs change your metabolism. That's where to focus. Yes, you want to get a little bit of aerobics, but you got to get that resistance. You got to get that hit and rehit. As we said, sleep is critical, and it's been a major neglected factor. And it's more than just sleeping 8 hours. It's the quality of your sleep, sleep hygiene, getting that resistance and hit training so you do sleep better. You start to reverse that vicious cycle. There are so many vicious spirals associated with prediabetes, diabetes, loss of insulin receptors, loss of those capillaries in those leg muscles. You want to reverse all of that vicious spiral. As I said, medications and supplements can help, but lifestyle is the key. You can track your progress with something like a Whoop or an Oura Ring. I'm doing both. And here's the thing. The Whoop is very picky and very critical. The Oura Ring, well, the Apple Watch is very forgiving, and the Oura Ring is probably the most realistic. It's the balance between the two. I keep thinking we need to do some more videos on that because that's going to be growing. Use of wearables. Stress is continuing to be an emphasized thing, but one thing that very few people actually deal with. Things like breath control. They sound kind of woo-woo to some people, kind of silly, but they actually work. If you're actually trying stress management or breath management for stress, and you're not getting a big impact, you're probably not slowing your breath down enough. You need to think about getting from a normal respiratory rate of about 20 per minute down to less than 10. We're talking about really slowing things down. And again, stress is one of the more common risk factors. And of course, yes, look at things like adjusting your work-life balance, healthy relationships, healthy communities, meditation, mindfulness, life purpose, toxins. There are hundreds of toxins. And as we mentioned, we want to avoid them. Anything from microplastics to heavy metals to parabens to phthalates. It's nearly impossible to avoid all of them, but just be aware and start making those initial steps. Now, when you talk about supplements, they're a tool that are just a tool. Again, you cannot out-supplement a lifestyle. Some of the key supplements that we use are vitamin D and niacin, magnesium, vitamin K2, nattokinase, berberine, bergamot. And yes, we use medications as well, like aspirin, metformin, low-dose statins. Never use high-dose or even mid-dose statins. And a lot of times our patients elect not to use statins or any other medication. That's fine with us. We're not Luke Skywalker. Our patient is Luke Skywalker. We're just Yoda. We've been in a lot of these battles, and we have a lot of tools that we can use to help that patient and a lot of good advice. So, bempedoic acid or Nexletol. If you've been hearing about things that lower cholesterol, that's been touted as the kinder, gentler cholesterol-lowering medication. We have some people that want to take that. We got a lot of lean mass hyperresponders, and we got a lot of patients with a thing called FH, familial hypercholesterolemia. Some of those, not most, but some of those elect to take one of the things called the PCSK9s. You may have heard of it, Repatha. And we got a lot of people who are on a weight loss journey. We do have a lot of folks that elect to use Ozempic or Mounjaro. And as you've heard, they have revolutionized weight management, but they have their own issues too. Just like any prescription medication, they are not harmless, and they need care in taking them. Those, by the way, are some of the best medicines that have come up now for management of diabetes. And we also use some things called SGLT2s. You may have heard of those, Jardiance and Farxiga. Those are things that, again, totally change the world of diabetes management. If you have to take insulin shots, that's a big deal. Those things are dangerous. The GLP-1s, like Ozempic and Mounjaro, and the SGLT2s, like Jardiance and Farxiga, are much, much better ways to go. Here's the bottom line. I've gone through a whole litany of list after list after list. And you know, if you're practicing good medicine, you do go through a lot of lists. But here's the thing. Metabolic disease is by far the number one cause of cardiovascular inflammation, cardiovascular plaque, and therefore the number one cause of heart attacks, strokes, number one cause of death, number one cause of permanent disability, number one cause of kidney disease, blindness, even erectile dysfunction for men, and Alzheimer's is being called type 3 diabetes. There are no signs. There are no symptoms. So get tested. Stop guessing. Stop trying to feel lucky. Here's the thing. You don't want to know if you're sick, but the bottom line is you really do. Once you know if you're sick, you can take that risk right off the table and the risk of all of those bad things that I just listed. Lifestyle is the most important intervention. Medications and supplements can help in certain situations. So your journey starts here with this video. Use that to find plaque.